My name is Dr. David Benversi, and I'd like to share with you the most effective ways that I've found to relieve the pain and symptoms associated with lower back pain. Now, there's three main therapies that we use in our office to help out with this, and by themselves, these therapies are very effective in helping out with the lower back pain. However, when used in combination, they speed everything up and they're much more effective. Those three therapies are the chiropractic adjustment, electrical muscle stimulation, and traction. The chiropractic adjustment works in three main ways. It works and helps out with the disc in the lower part of the back, it works out with the joints in the lower part of the back, and it also helps out with the spinal nerves that are coming out of that lower back. Now, with regard to the disc, when the chiropractic adjustments are applied to that lower part of the back, it will reposition those discs and help out and reduce the amount of inflammation and help out with any type of disc herniation or disc bulging in that area. The next thing with regards to the joints in the lower part of the back, when those joints have a lot of pressure pushing through them, there's very sensitive receptors in those joints, and if there's a lot of pressure, that will cause pain. With the chiropractic adjustment, we basically help relieve that pressure and thus help out with the pain in that lower part of the back. And then with regard to the spinal nerve, when we are adjusting that lower part of the back, the nerves are allowed to have a lot more space, and they're able to not have anything pressing on those nerves or pinching the nerves at all when we're applying those chiropractic adjustments. Next, with regard to the electrical muscle stimulation, basically we apply several pads to that lower part of the back and provide a low pulsating electrical current through that area. And that does three main things for us. It reduces the amount of pain, it will reduce the amount of muscle spasm and tension, and it also is going to reduce the amount of inflammation. Now, with regards to the reduction in the pain, when we are providing that electrical stimulation through those areas, it is more or less acting as a nerve block, or not allowing those nerves in that area to transmit that nerve signal to your brain. The next thing that it does as far as the reduction in the muscle spasm is when that mild electrical current is going through that area, a lot of times those muscles in the lower part of the back, when you're having low back pain, they're extremely tight. So that electrical current is going to help relax those muscles and effectively reduce the amount of pain that we're experiencing in those areas as well. And lastly, we're going to be reducing the amount of inflammation in that lower part of the back as well. With the pulsating electrical current, it acts as a mechanical factor that helps more or less push that inflammation out of that area, and inflammation is one of the main contributing factors to the pain in that lower part of the back. Lastly, with regards to the traction in the lower part of the back, we're going to be looking at two main factors that it's going to help out with the traction. One is going to be with regards to the disc in that lower part of the back, and the second one is going to be with regards to the joints in that lower part of the back. When we apply traction to that lower part of the back, we are going to be more or less allowing there to be more space and a lot more room for those discs to be able to function and not have the pressure applied to them, which is going to effectively reduce the amount of pain in that area. Then if we're looking at the joints themselves, when we have a lot of pressure going through those joints, particularly the facet joints, which is the main joint in the lower part of the back, there's going to be very highly sensitive receptors in those joints, and when we reduce that pressure going through those joints, it's going to effectively reduce the amount of pain that we're experiencing as well. Now, when we talk to our patients that we're treating with lower back problems, a lot of times they're telling us about how much they're having a reduction in the pain that they originally had. They are increasing the range of motions, and they're also decreasing the amount of muscle spasms and tightness. In addition to that, since all the nerves that come out of the lower back typically go down into the legs, a lot of times we'll see things such as leg pain or numbness and tingling down into the legs, or things such as sciatica being helped out as well. So with all those symptoms being reduced, these people are able to do things throughout their day that they haven't been able to do pain-free before, such as going to work. They're able to work the entire day pain-free. They're able to work for longer periods of time and do the things they need to there. Then with regards to their activities of daily living, such as hygiene and getting things ready that way, they're able to step over their tub to get into their shower. They're able to get their pants on. They're able to tie their shoes, things along those lines. They're able to bend over. And lastly, they're also able to sleep better at night, and they're typically going to be sleeping better. They're going to be sleeping longer, and they're going to feel more rested in the morning if they're not experiencing that lower back pain. If you're in pain, I'd love to help. Please give us our office a call at 618-519-9334.